Why is syllable structure key for CAS therapy? Imagine trying to build a tower with uneven blocks. If the blocks are all different sizes and shapes, it's hard to make it stable. That's similar to what children with childhood apraxia of speech face when trying to say words. Their brains struggle to plan and organize how to move their mouth muscles to produce sounds smoothly. In speech therapy, focusing on how syllables are put together helps children learn to move their speech muscles in the right order. Syllable structure is about how sounds are grouped into parts like ba, d, or ma. When children practice these parts, they learn the patterns of speech. This is especially important for children with childhood apraxia of speech because they have trouble transitioning between sounds and syllables. Children with childhood apraxia of speech do not just have trouble making individual sounds. They also find it hard to smoothly connect sounds within a syllable and from one syllable to the next. This causes their speech to sound choppy or inconsistent. When therapy targets syllable structure, it helps children practice the movements needed to produce each syllable correctly. Repeating these patterns helps their brains learn the right way to coordinate their mouth muscles. One popular therapy approach that uses syllable structure is called rapid syllable transition treatment. It focuses on practicing syllable changes in made-up words that have multiple syllables. This helps children improve their ability to move from one sound to another quickly and accurately. By practicing different stress patterns and syllable lengths, children learn to produce speech that sounds more natural. Focusing on syllable structure also helps improve prosody, which is the rhythm and melody of speech. Children with childhood apraxia of speech often have trouble with emphasis on certain syllables. When they practice stressing different parts of words, their speech sounds more expressive and easier to understand. Therapists often start with simple syllables like ba or d and gradually move to more complex ones. They use repeated practice, rhythmic cues, tapping, or clapping to help children internalize the timing and stress of speech. This kind of practice builds stronger motor plans for speech movements. In the end, working on syllable structure is essential because it directly addresses the core motor planning issues in childhood apraxia of speech. Improving how children produce and transition between syllables makes their speech clearer and more natural. This helps children communicate better and speak with confidence.